Now, the World Health Organization has hailed Africa's remarkable progress as the world marks World Polio Day 2025. In a message to commemorate the day, WHO Regional Director for Africa, Dr. Mohamed Janabi, said this year's theme, End Polio, Every Child, Every Vaccine, Everywhere, reflects a renewed determination to ensure that no child is left unprotected, regardless of geography or circumstance. According to Janabi, Africa's success in 2025 has been powered by stronger cross-border coordination, expanded surveillance, and the deployment of cutting-edge digital tools that have enhanced efficiency, accountability, and reach. Now let's turn to Lizzy Asomugha, President Rotary Club of Abuja, to speak to the disease and what Nigeria can do to beat it to zero. Liz, you're welcome. Thank you very much for joining us this evening. It's good to have you here. Grand. Now,
thank you for having me.
Good. So, Africa has vaccinated nearly 200 million children this year alone. That's a very big feat, according to the WHO. Now, an incredible feat given the security challenges and also logistic challenges across the continent. From your field of experience, however, what makes reaching that last child, like this year's theme is saying, what makes it difficult? What kind of community strategies have proven most effective in breaking through?
Thank you for having me again. As you know, today is World Polio Day, and the theme for the year is finishing the job, our legacy for a polio-free world. And I can tell you that Rotary International is making incredible work all over the world to make sure polio is at zero. And this polio can actually be avoided because it's a highly infectious viral disease that leads to permanent paralysis. It can cause flu-like symptoms such as fever, fatigue, headache, vomiting, and even a sore throat. And it can also cause neck fitness pain, and the rest of them. And it can be avoided if mothers can immunize their child. Polio has no cure, but polio can be avoided. A syrup must be taken to make the world a polio-free day.
Okay, well, Liz
has done incredibly well to make sure that polio is at zero. And we have not really recorded a case recently. For now, I would say polio is 99% in Nigeria. For what we have now, countries we have now with polio, just as Afghanistan and Pakistan. But for Nigeria, with the help of Rotary International, polio is almost come to an end.
99% eradicated in Nigeria, like you said, but there's that 1%, and this year's theme says reaching that zero level. What are the strategies that have proven useful?
Okay, the strategy we have done so far is that we have a week-long activities to mark the World Polio Day. We went for immunization yesterday at the 6 area councils, where we have our team of medical doctors, creating awareness, advocacy, and telling them the importance for every child to be immunized for us to have a polio-free day. Rotary is made up of professionals, so those in the medical field led by the district polio chair in District 9127 Abuja, who is also a medical practitioner. She led her team with the district governor, Dame Joy Okoro, to seek the councils to make sure that every child is immunized. And to tell you, this year, the case is different because it's no longer the situation where some northern people and some people in the country reluctantly do not come out to immunize their child. But now, no parent wants to have a deformed child. So the turnout was huge, and we were able to immunize a lot of children in the 6 area council in every city.
Liz, indeed, this year the case is very different, especially in the north. We have security challenges, and I'm wondering how humanitarian workers can be better protected, to face the challenges of not just insecurity, but also logistics in these environments while they're still keeping immunization campaigns consistent.
Oh, yes, there is security challenge, but I can assure you that polio has presence in over 140 countries. And in Nigeria, in every location, there is a particular Rotary club to cover within that style. So, security situation is a problem, but polio has presence in every community. I represent people within the ASO drive. We have in Maitama, we have in all the areas. So the people close will go to the one close to them just to immunize children and to make sure that the message is being passed to take a vaccine and to create a polio-free world and polio-free country.
There's still talk about vaccine-derived polio virus in a few areas, and I'm wondering what should humanitarian organizations be doing now to prevent a resurgence, especially in places where health services are weak on trust. And trust in Nigeria is something that it took a while for Nigerians to trust vaccinations. So what's your response to that?
Okay, in Rotary, we have what we call Rotary Foundation Fund. So it's from there that we mop up funds to make sure that the vaccine are being made available to all the areas and to all the communities and all the villages. It is being made available for them to take to have a polio-free country.
Okay. Now, Liz, how important are these innovations that we see when it comes to vaccinating that one last child when you compare it to simple community-based approaches like trust building and door-to-door campaigns?
Okay, now, as I told you, we have a week-long activities whereby we even have a golf tournament to raise funds and also create awareness. We did tennis, we were in the mosques, and we also went to the area council, which is the door-to-door campaign. All the 6 area council in FCT were covered. No place was left behind, including Amak, including the city, from Abaji, Kwali, Ube, Buwari, and the city center. Everywhere was covered door-to-door to make sure that every child that needs to be immunized, of course, polio happens to children from 5 years and below. So this door-to-door campaign, using the local chiefs in the communities to make sure that everybody comes out to take a vaccine, has actually helped, and which has been a start project of Rotary International to make sure there is the polio-free country. There's still a measles case in United States of America. We feel that measles has gone, but now there are still recording cases of measles. Yes, Nigeria, we can say it's gone, but even in Western world, like United States of America, there is still measles because that 1% was left unattended to, and it keeps to spread. People keep contaminating. Of course, this disease is spread so fast. That's why the 1% must be fought.
So do you think these new innovative methods are going to help get that 1% then?
Sure.
So Liz, what's the message? What's the message that you would give to parents or caregivers today, especially those in rural areas or underserved areas, about why routine vaccination still matters to eradicate that 1%?
The message I will leave is vaccination protects against both wild polio virus and vaccine-derived polio virus. Everyone needs to be vaccinated because if a child is affected, it can spread all over. Remember, this is an infection disease that can lead to pollen paralysis, and also it can be contacted through poor sanitation, through bad water, and even through food. So washing hands, as we did in COVID-19, is still very important. People in the rural areas, wash your hands, keep healthy hygiene, avoid poor sanitation so that this disease can stop spreading. The 1% can be eradicated totally.
Well, thank you very much, Liz, and we hope that that happens. We would like to see a world, Nigeria, where we have 0 polio cases. Thank you, Liz.
Thank you for having me.
You're welcome.